So, glutathione is an amazing antioxidant that our body can make naturally, but as your body ages, it decreases. Let's start out talking about what is glutathione. So, glutathione is a combination of three amino acids. So, it's cysteine, glycine, and glutamate. These three amino acids are together and they make up beautiful glutathione. So, talking about that, you don't want to just take glutathione orally because it's going to get broken down just into these three amino acids, or just taking these amino acids can support glutathione, but you don't know exactly what your body's going to do with these. So let's say like N-acetylcysteine, pretty decent at increasing glutathione, but it just has cysteine and it might be used all over the body. So I like doing glutathione and I like taking it in its liposomal form, meaning it's going to get absorbed differently. It's going to be absorbed in the lacteals in your stomach. So it's not going to go through all the digestive processes and it's going to get absorbed through there and bypass the liver and get right into the bloodstream. So that's my favorite way of taking glutathione orally. And even better yet, I love it IV glutathione 100 times, maybe even 1,000 times better than doing anything orally. It's a very strong antioxidant and it's great at detoxification. And I love it for healing the mitochondria. So aging is related to mitochondria degeneration. That's what's happening. When you age, your mitochondria are degenerating. So whatever treatment we can do to help support your mitochondria is going to decrease the aging process. And glutathione is one of my favorite healers of the mitochondria because it decreases that inflammation in the cell, but also helps prevent the damage to happen to the mitochondria. So there's a lot of oxidative stress, which is a major cause of aging. It really, one of the main, if not the only one that really is causing aging, is the oxidative stress that's happening in the body, causing that damage to the mitochondria. Glutathione helps clear up that oxidative stress. That's what antioxidants do, is they help with the oxidative stress that's happening throughout the body. And then aging is related to inflammation. So, and it also is good at detoxification. The more gunk you put in your body, the more toxins and poisons you put in the body, the faster you are going to age. So I don't know if many of you have seen that a lot of people that get chemotherapy, for example, it's pretty toxic. So you do need it in some instances, but they tend to probably age about 10 or 15 years. It's because of that trauma that's happened to the mitochondria, the degenerations that happen, and all that damage that's happening is going to age the body. If you don't have good detoxification mechanisms in there, you're going to continue to have more trauma that happens and more damage that happens to the mitochondria, damage to our collagen, etc., that makes us look older. So that's what's great about glutathione. Great antioxidant, great detoxifier, and it's going to heal your mitochondria. So why do we need to take glutathione when we should be getting it just from our food? Well, we do get it from our food, but as we age, there's more oxidative stress happening, more trauma that's happening to our mitochondria in age. I don't know why this happens, is your glutathione production decreases. So why do we need a supplement with glutathione when we do get glutathione from just amino acids from our food? So if you were a young guy or young girl, you most likely, if you were healthy, wouldn't have to supplement with any glutathione because your body is making plenty of glutathione. But as you age, when you start getting over 40 years old, your glutathione starts getting lower and lower and lower. And your body is really not able to make enough glutathione in response to that from just the amino acids because there's a lot of damage and degeneration that is happening to the body. And your body compensates by making a lot of glutathione. But just naturally, as we see in research, is the body just starts making less glutathione. And this might be because, I don't know why, we don't want to live forever. The bodies aren't supposed to live forever. So it starts decreasing its glutathione over time. There's a lot of things that happen with aging process. And you're like, what? Why does that happen in the body when it could just keep it strong forever? And this is one of them, is glutathione decreases as you age. And one way we can help support not aging, I mean, we're all going to age, but we could decrease that aging process through actually taking pure glutathione. What might you experience when you start doing glutathione? Really, what you're going to experience is not automatic. It's going to be a slow process. What we are is starting to heal the mitochondria, starting the detoxification processes, decreasing that oxidative stress that's happening on the body. So it's going to take at least several months to really notice anything. I mean, at least for me and some of my patients, you definitely could start noticing more mental clarity and more energy within a couple weeks. You might even start noticing less joint pain within a couple weeks. But to get the total results of it it's going to take at least a couple months to start noticing things. And what it is you're going to start noticing improvements in what we call the aging process, right? Our brains just don't work as well. They don't click as well. We can't remember things as we used to. So brain has 70% of our mitochondria. So if we help support that mitochondria, we're going to start noticing things in our brain a great deal. So we're going to have better memory. We're going to be thinking better. We're going to be able to focus better. It even can improve mood because it's going to decrease that inflammation in the brain. So you can start improving your anxiety, depression. It's going to help decrease that joint pains that we talked about. It is going to improve energy. It is going to help with more physical endurance and not getting as tired easily when you're doing physical activity. So these are some of the things you're going to notice. And then over time, you're going to start noticing that your skin is more clear. You might not even be getting, most people don't really get zits as they're older, but I'm seeing that a lot of people are talking to me about that. But your skin is much more clear. And it also is, I call it has a better glow to it. It's not necessarily going to take away wrinkles. We have other things for that, but it can help decrease wrinkle formation. Wrinkles form from degeneration of the collagen in our skin, and that happens from the oxidative process. So if we decrease that oxidative process happening through taking glutathione, it can help decrease or slow the wrinkles that form. What's the best way to take glutathione, and how long do you have to do it, or whatever? So oral glutathione, not my favorite way, but it works well. IV is my favorite, but who's going to come and get an IV all the time, right? So oral glutathione liposomal form is good. You get that, you take that daily. I want you to take at least 200 milligrams to 400 milligrams daily of glutathione to decrease that aging process. And then my recommendation is I like to get a loading dose. So let's say I want to be taking glutathione. I like to do a loading dose of IV glutathione. I do that for like a month. Let's say you come in once a week or 2 times a week, you're getting IV glutathione to really boost those glutathione levels up. And then you could give it a little break and you take the oral glutathione, maybe come in every 1 to 2 months to just get an IV. I think doing it that way is going to really get the greatest benefits from glutathione. So are there any side effects of taking glutathione via IV for a long period of time? Really, very little to none. I mean, if the doctor office is doing it appropriately, they use sterile technique, they have a clean office, and they know how to prepare it right, there's really no harm of getting an IV at all. It's very safe. It's really not a big deal. Very sterile. And glutathione, it only benefits you. Now, there are some people that might have some detoxification issues. They might have some sulfite issues, sulfur. Glutathione does have sulfur in it. So if they don't do well with sulfur, we talk about some other things to do so they can do glutathione, like we take high doses of molybdenum for a little bit so they're able to help their sulfite oxidase enzyme work appropriately, and then they could feel really good. So some people that don't do very well with glutathione, it's because their sulfite oxidase enzyme's not working very well genetically, and we help support that pathway so they're able to actually do it. But really, that's a small minority of people. Most people aren't going to have any side effects at all, except some people can feel a little bit brain foggy for a couple hours because of all that glutathione that's getting in the brain. And then that clears up all the cobwebs that are hanging out there anyways. So yeah, not really any side effects, except if you don't have a good sulfite oxidase enzyme, or you have a sensitivity to glutathione for some reason, which I haven't necessarily seen besides that liver issue with the sulfite oxidase enzyme. So what would be the cost of getting IV glutathione treatments? And this brings up something that I didn't talk about is, okay, you get IV glutathione, but it only is going to hang out in there for 30 minutes and then it's going to break down. So what I do in my office is I'm always going to give cofactors for glutathione, which are nutrients. So I give an IV nutrient drip, which has the magnesium, it has the zinc, it has the B vitamins in there to help replenish the glutathione so it's able to last a lot longer in the body and do the benefits that it's doing for a long period of time. So if you just go to a clinic and they're just doing glutathione, you're going to get some good benefit, but it's not going to be anything like doing a nutrient IV beforehand. So visit my website, integrativemedica.com, find my phone number there, give it a call, talk to my receptionist, and set up a visit with me or some of my other great doctors. You could also sign up an appointment directly on the website. If you want to learn more about glutathione or other amazing nutrients, click my videos to the right. I'm Dr. Jake, and I'll see you there.